welcome back to ETAW. We're going to be talking about how we pack, how we take care of large lacerations for immediate treatment. This is going to be part of the March algorithm or S-March algorithm. It's more current. So the first thing we're going to do when we come up and we see a wound like this, we're going to see that it's a big, deep wound. There's blood, significant amount of bleeding. First thing we're going to do is we're going to stop that bleeding by putting on a tourniquet. We're going to crank that down until the bleeding stops. Depending on what type of tourniquet you're going to get, you're going to lock in that tourniquet. Well, any of the tourniquets you lock in, it's just how you do it. So the next thing we're going to do is we're going to assess this wound. In order to assess the wound, we're going to have to open this up. We're going to have to get so we can get good clearance on it so that we can really see what's going on. Plus that helps get any of this stuff, the clothing, anything that's been shoved inside that wound out. So we're going to take a look at it. Next thing we're going to do, we're going to get our packing gauze. Now there's a couple ways to do this. Some people will put it down their shirt. Kind of the way I was trained is that we keep it all in one hand, but the thing that's important is how we pack. So we want to get down in there, we want to find that bleeder, and we want to put pressure on it, and then we're going to come back. We're going to push that all the way down inside, all the way to the base of the wound. We're going to try to pack in any gaps that we feel. We're going to take that down, keeping our finger on that bleeder. We're going to keep it coming down. We're going to pack in, keeping that finger on the bleeder. Want to really pack that in there. This is the trainer that we made last video, or one of the trainers that I use. I shouldn't say this is the exact one. So we're just going to continue to pack that in, back and forth, back and forth. We're going to fill every nook and cranny of that gap that we can get. Z-fold gauze will work, rolled gauze will work. It's all about keeping that pressure on that bleeder and really packing down in there. Now, one of the things when I'm packing that I do, now this is more for after we're packing this, I leave one end out. So if I end up going with 2 rolls of gauze that I'm packing with, I have 2 tabs out here that are sitting out here. That way, when I'm unpacking it, or when the patient gets to the hospital and they're unpacking it, that we can keep track of how many rolled gauze, how many pieces of gauze we got to pull out, because that's going to be a huge source of infection if we leave one of those in there by mistake. So then we're going to cover it. So we're going to take our Israeli bandage. This is just going to be easier if I set it up. We want this bar so that it's right over the top. We're going to put it through. I think this is about the only thing that's easier on a live person. We're going to put that through. The second time around, we're going to come back. That's going to put all of this pressure right here, this pressure pad right on it. First one, I'm going to go around. Second one, go under. Third one, we're going to go around. Now, some of the Israeli bandages have this little bar. Some of them you don't. you just pack in. Squinch that in. Now, as any medical treatment that we do, once we have this packed, every single part we want to assess. When we put on a tourniquet, did we stop the bleeding? If not, you keep on turning the windlass until it stops. When we're packing, okay, are we packing? Do we see any more bleeding? Are we packing everything in there? And then the third is going to be this Israeli bandage. Once we bandage it up, are we good and controlled on bleeding? Has the tourniquet moved? Tourniquets, the body is not a nice cylindrical like this. It's a big triangle, so these want to move down all the time. So you always have to make sure that you're reassessing the tourniquet, make sure that the tourniquet is staying in the same place, that it's not moving. Especially as we start moving this patient. Just as your muscles move, they get bigger, they get smaller, they contract. So this person's leg. Every time we do that, that has a tendency to move these tourniquets. So we got to make sure that the tourniquets are in the right, correct place. So that's all for now. That's how we do our wound packing. If you have any questions, let us know below in the comments. Have a great day.